What is fatty liver, and what does it feel like to have one? Did you know that 25% of America's public have a fatty liver? And you might be wondering what it feels like. We will be covering all the basics today. And hopefully by the end of this video, you will have grasped all that you need to know to get started on your journey to recovery. Did you know that fatty liver is also called hepatic steatosis? Yes, it is. And it occurs when excess fat builds up in the liver cells. And there are two main types. The first type is non-alcoholic fatty liver disease, or NAFLD for short. This type isn't related to alcohol consumption and is often associated with metabolic syndromes like obesity, diabetes, and high cholesterol. The second type is alcoholic fatty liver disease. This type is directly related to heavy alcohol consumption. Now that we've established that there are two different types, you're probably asking yourself, well, what causes fatty liver? And I can tell you that it's not one cause, but actually several factors can contribute to the development of fatty liver. We've put together these factors in a list to give you an overview. We also have many resources on our channel, so do check it out later. Hey, give us a like if you're getting some value so far. Okay, first up on this list is obesity. Excess body weight is closely related to liver disease and can lead to fat accumulation in the liver. The second is insulin resistance. Fatty liver is often seen in people with type 2 diabetes or metabolic syndrome, such as in diabetes and high cholesterol levels. Which brings us to our third point, high cholesterol and triglycerides. Elevated levels of fats in the blood lead to the fat traveling through the liver and getting deposited there. We definitely can't ignore number 4, poor diet. Consuming high sugars and refined carbohydrates triggers the liver into converting glucose into glycogen, which is the stored form of sugar in the liver. When it is in large amounts, it is then converted into fat, leading to an enlarged fatty liver. On to number 5, alcohol consumption. This leads to type 1 in the case of alcoholic fatty liver disease. This is due to the repetitive liver injury caused by alcohol and high sugar deposits. Number 7 is genetic factors. For these people, there is usually a family history of liver diseases. There are also some genetic diseases that lead to repetitive liver injury. Eventually, this can lead to irreversible liver disease, such as end-stage liver cirrhosis and permanent scarring. Now that we've discussed the factors contributing to fatty liver, let's move on to how it is diagnosed and tested. Understanding the diagnostic process is crucial for catching the condition early and managing it effectively. Firstly, routine blood tests can provide initial clues. Elevated liver enzymes such as ALT and AST can indicate liver inflammation. However, these enzymes can be elevated for various reasons, so further testing is often necessary. Next, imaging tests like ultrasound, Connecticut scans, or MRI can help visualize the liver's condition. These non-invasive tests can reveal fat accumulation and help determine the extent of liver damage. In some cases, a specialized test called fibroscan may be used. This test measures liver stiffness, which can indicate scarring or fibrosis. For a definitive diagnosis, a liver biopsy might be recommended. This procedure involves taking a small sample of liver tissue for microscopic examination. While invasive, it provides the most accurate assessment of liver health. Remember, early diagnosis is key to managing fatty liver effectively. Now that you have a definitive diagnosis, it's time to take action. Addressing fatty liver involves crucial lifestyle changes that can significantly improve your liver health and overall well-being. First and foremost, focus on a healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins is essential. Avoiding sugary and processed foods can make a big difference. Opt for natural and nutrient-dense foods to support your liver function. Next, incorporate regular exercise into your routine. Physical activity not only helps reduce liver fat, but also improves your overall health. Aim for at least 150 minutes of moderate exercise per week, such as brisk walking, cycling, or swimming. Weight management is another critical factor. If you're overweight, losing weight gradually can have a significant positive impact on your liver. Aim for a slow and steady weight loss, 2 pounds per week, to ensure sustainable results. Limiting alcohol intake is crucial, especially if you have alcoholic fatty liver disease. Reducing or eliminating alcohol consumption can prevent further liver damage and promote healing. Consider joining support groups or seeking professional help if needed. Follow your healthcare provider's recommendations closely. This includes managing any underlying conditions like diabetes or high cholesterol. Medications, if prescribed, should be taken as directed to support your liver health. Remember, fatty liver is a condition that can often go unnoticed but has significant implications for your health.